Yes. Why didn't it say I was started recording though?
Oh,
Oh yeah, there we go.
Give me the option to share my screen. So what do I do? Miss Donnelly?
It's not by the leave button?
No, I'm not seeing it. Well, let me close out my chat and then try it again.
It might be, yeah, and it's right above the record bar.
I got it. It made me close out my chat and do that. Okay, can you guys see my presentation?
Yes.
Can you still see my presentation?
I think it's probably loading. Because there's just a white screen.
What about now?
There you go.
Yeah.
Okay, so I've realized that on Teams I can't full screen my presentation, like put it in present mode. So I apologize that this is what it will look like. Is that okay?
Totally okay.
Love it. Okay, well, let's get started then. Hi. My name is Georgia B. Page. My pronouns are she, her, and I'm a senior at Roosevelt High School. I spent this semester taking a class at University of Michigan called Diversity and Social Justice and Social Work. It covered a lot of broad range of issues that social workers can get involved with to create more equitable spaces in our communities. However, the topic that stuck out most to me was health disparities in BIPoC communities. So in case you don't know, BIPoC stands for Black, Indigenous, and Other People of Color. And so that is what I will be focusing on today. So welcome to my presentation, Health Disparities in BIPoC Communities, Understanding the Reality and Creating Solutions. So first, before we dive in, we have to begin to understand the problem. So health inequities are systemic, ingrained, and unjust barriers that prevent a segment of the population from the opportunity of health, leading to health disparities. So overall, what we see is that people of the BIPoC community oftentimes have lower life expectancies and more health issues because of these systemic health inequities. So that is the segment of the population that we're going to be focusing on today. So as this might be a new topic for some people, let's start to introduce you to some numbers that solidify our reality of these health disparities. So I'm just going to go through a quick list of statistics just to kind of introduce you to the reality of this issue. So Black women are 40% more likely to die from breast cancer. Latinos are 50% more likely to die from chronic kidney disease, and this is all in comparison to their white counterparts. Black infant mortality is 2 times higher than the white infant mortality. Black children with appendicitis go without pain medication at higher rates than white children. We'll see that that's a common theme. And then one of the most shocking statistics is in 2006, the rate of in-hospital death was 248% higher for Black women, 50% higher for Latino women, and 69% higher for Asian and Pacific Islander women than it was for white women. So these shocking statistics is kind of what led me into wanting to dive into this issue today. So while there's a large slew of issues that we can cover, one of the first issues I want to focus on today is negative birth outcomes for Black women. So Black women have a 3 to 4 times higher rate of negative birth outcomes than white women. A negative birth outcome is any situation of premature birth, low birth weight, or the child dying due to all-cause infant mortality. So Black women have 10 infant deaths per 1,000 when they've graduated, college. That's their level of education. While white women that graduated college only have 4 infant deaths per 1,000. Even more shockingly, Black women who have graduated college and attended graduate school to some amount still have higher infant mortality than white women that never completed high school. So that kind of shows the shocking reality. So it doesn't have to do with educational attainment. Second of all, it's not genetic. So in a study that tried to understand whether or not these low negative birth outcomes were genetic, they compared the birth outcomes of African women that had never been to America and found that they were equal to those of white women in the United States. However, if those African women's daughters were to move to the United States, their birth outcome chances would be equal to Black women that lived in the United States their entire lives. So we're seeing that it's not a genetic issue. It's an American issue. Let's look at Shanna, for example. So Shanna was a second-time mother. She had graduated and became a pediatrician. She was upper middle class, and she gave birth to her second son, Timothy, after the second trimester in 2010. Now, Timothy was born at 2 pounds and 9 ounces. And he did survive. He just turned 10 a couple of weeks ago. Or 11 a couple of weeks ago. However, what we found is that she was healthy, she ran, she didn't smoke, she didn't drink, and she's not an anomaly, as we've just figured out. So what is causing these high negative birth outcomes for Black women? The answer is cortisol, aka the fight or flight response hormone. So oftentimes you can think of it as if you're in a dangerous situation or something that's causing anxiety, you're going to put your foot on the gas, and it's going to give you the energy to get out of that situation or protect yourself. But for Black women who statistically have higher cortisol levels than any other individual, it's like having your foot on the gas while your car is in park. So after a while, it's going to wear down your body. It's going to wear down your mind. So what's causing these high cortisol levels? The answer is racial bias. Black, Latina, and Native American women all have higher cortisol levels, and cortisol is released during pregnancy. So we can see that direct correlation between these negative birth outcomes, these premature births, and these low birth weights because of the high rates of cortisol that Black women get from the stress that comes from living in a society where racial bias is embedded into their daily lives. However, we have been able to find that support groups for pregnant women where they talk about racial bias that they've experienced actually helps to reduce those cortisol levels. So having an outlet to kind of deal with that stress drops cortisol level and then overall helps create less negative birth outcomes. However, it is not just women that experience these health disparities. The health of Black and Latino men is also affected. So if we take a look at this graphic here, we're seeing that Black men are 31% more likely to die from cancer, 60% more likely to suffer a stroke, and this is again all in comparison to their white counterparts. They die twice as often from diabetes-related complications. Black men and Latino men with chest pain wait longer on average to receive an EKG, and Black and Latino men with long bone fractures wait longer for low doses of pain medication. So oftentimes doctors are more resistant to give people of color pain medication, particularly men of color, and overall they are receiving less pain medication. So what is the reason behind this inequity, right? We want to talk about the social theory briefly. So the ideas of what causes inequity stemmed from a 19th century French philosopher named Augustus, and it's called the structural functionalism theory. So he studied and compared the interconnected social body of society with biological functions of living organisms. And he came to the conclusion and emphasized the importance of social consensus and maintaining social balance, because basically he argued that some aspects of social life are dysfunctional because they threaten to disrupt social stability. Now, this kind of evolved into structural role theory, which became very prominent in the 20th century, which you may have heard of. Where each person in society has been ascribed a social status based on things outside of their control. So these things can include race, gender, national origin, and disability. So those things that they cannot control basically decides their social status and the privileges they have within society and the roles that they're able to take on. And so that directly leads into this idea, or rather people being able to justify in their minds why inequities and inequalities exist. However, of course, this is, racist, and it has limitations that people began to more openly recognize in the 1960s with the civil rights movement, because that was direct proof that protest and conflict could directly lead to positive change. And feminist scholars around the same time began to argue that this structural role theory that came about in the 20th century was just a tool to kind of try to uphold the patriarchy. So overall, this theory is problematic because it enforces the idea that struggles for equality are inherently dysfunctional and bad for society. However, many people still believe in it today and apply it to today's society. So what part of society actually, have a role in determining health? That brings us into social determinants of health. So basically, how you live and where you live are extremely big factors in determining your health for the rest of your life. So there's two main portions of social determinants of health. That's going to be neighborhood conditions, so where you live, and work conditions, how you live. Neighborhood conditions can include air pollution, water contaminants, exposure to lead, paint, mold, and pests, access to healthy foods, so whether or not you live in a food desert, safe places to exercise, and neighborhood services such as transportation, trash, and streetlights. We also have work conditions though. So, your exposure to work-related injuries, or if you have a sedentary job, your exposure to high noise, hazardous chemicals, mental health stressors, and most importantly, access to work-provided benefits and insurance. So whether or not you're able to take care of yourself at the end of the day when you leave work. And then a highly studied contributor to physical and mental health outcomes is educational attainment, as it directly affects the knowledge and literacy that you have surrounding health, work conditions, income and resources, and social status. So we can see that it kind of turns into a cycle almost, right? Where you go to school determines what kind of job you have. What kind of job you have determines where you live. Where you live determines where your kids go to school, and that cycle continues. So all of these are going to basically decide the health outcomes for generations and generations of people. However, I want to remind everybody today with a quote from Toni Morrison that this is flesh I'm talking about. Of course, we're going to break this down into statistics. That's the easiest way to understand it. But I do want to remind people that this is the reality for almost every BIPoC American citizen. And this is the reality when it comes for, people of color having to interact with the healthcare system. So I just wanted to bring us back to focus there for just a second. So now let's talk about the role of healthcare providers and whether there is one. So there's a big debate in the healthcare community about whether or not they have a role in these inequities. So in a study conducted in January of 2018 titled "What Causes Racial Health Disparities? A Mixed Method Study Revealing Variability in How Healthcare Providers Perceive Causal Attributions," they decided to take a look at whether or not healthcare providers had a role in inequities and how they, as individuals, perceive their own roles in inequities. So there was an increase in discourse surrounding systemic racism around the early 2000s, specifically around, healthcare. However, this study right here that was published in 2018 is the first study about the specific topic of healthcare providers contributing to inequities since 2002. It's still a relatively new concept, and it's still kind of novel, right? Like it's still relatively new. But what the study found is that the way that healthcare providers engage, or the level of engagement that they have in their communities, directly impacts their perceptions of the factors that contribute to inequality. So if that individual believes that it is social and economic conditions that directly contribute to inequality and inequity, more so than patient-provider behavior and interactions, they're less likely to think that they have any role in the inequity, and thus that they really shouldn't be part of the solution. However, healthcare providers that believe that providers contribute to inequity and have a role in inequity also are found to be more ready and able to discuss race and racism overall. So people that are more educated on race and more apt to talk about race openly often share the same point of view that providers have a role in these systemic inequities. And now it's very important that we're starting to look into this since, like I said, it is relatively new, because what we found is that if providers don't see themselves contributing to the issue, they're overall less likely to see themselves in the solutions. If you don't see yourself in the problem, how are you going to understand how you can contribute to making, actual sustainable change? And this kind of connects to Bernard Weiner's theory of social behavior, which you might have learned about over the summer following the murder of George Floyd. That people respond to an event by judging its cause. So if they believe that an event is outside the victim's control, that's going to garner sympathy from them. However, if they believe that an outcome of an event was inside the victim's control, then that's going to be apathy from them. So the healthcare providers' perception as to whether or not the inequalities are within the individual's control or the patient's control is directly going to affect how they interact with them and the kind of care that they provide. Because individuals' casual attributions for problems, quite frankly, are more important contributors to their beliefs about solutions. So you might be, wondering, not all people think this way, so why is this such a prominent issue for healthcare providers? Well, research indicates that rapid and unconscious emotional and neural reactions to Black Americans occur for most Americans within 100 milliseconds, which is about 1/3 of the time that it takes for us to blink our eyes. Healthcare workers are not immune to this bias, and oftentimes these biases are far more impactful than the prejudices of others, as they can decide life or death situations and decisions. To quote Fannie Lou Hamer, "I'm sick and tired of being sick and tired." This is a reality for most Black and other Americans of color when it comes to the interactions that they have with the American healthcare system. They're constantly undermined, underserved, and underprotected by the healthcare system, as we've seen over the last 15 minutes. So now it's time to kind of talk about how can we make some sustainable change. So that brings us into our second part, which is creating solutions. So we're going to kind of start big and then work our way down. So first, government and policy solutions. So there are two distinct ways that through government and policy solutions, we can see an overall decrease in health disparities. So first would be increasing the minimum wage by just $1. So this study is based off the 2014 demographics of America, but by increasing the minimum wage by $1, there's a 1% to 2% decrease in low birth weight, 4% decrease in post-neonatal mortality, 2,790 fewer low birth weight births, and 518 fewer post-neonatal deaths for the year. So by directly investing into Black women and creating, people to actually be able to thrive as opposed to survive, we're overall decreasing that stress level, specifically in Black women, as we've seen, and all women of color, and that is going to decrease the chance and occurrence of these negative birth outcomes. But second is public education spending. So for every $100 invested into the public school system, there are 2 fewer deaths per 100,000 population. With 1 standard deviation change in tax progressivity, this results in 6 fewer deaths per 100,000 population. And this is per every $100 invested in the public school system. So by putting more money into our communities and investing in our youth and our women of color, we're directly seeing a close in these health disparities. Next, let's continue on this idea of the public education system. So what's a solution that the public education system can adopt? Education is supposed to be the great equalizer. We all know this. However, too often, what it turns into is tools being given to white students to promote their success and students of color being left behind. However, all students must have access to any and all resources that will make them successful. That is the role of school in our community. As an educator, you might be aware that some of the most common issues amongst young male BIPoC students is emotional instability, anger issues, and poor coping skills. Of course, this often comes from situations outside of school and outside of the school's control. So that can be unstable home life, food insecurity, etc. You may be thinking, this is just an issue inside of school. However, it can impact every single aspect of the child's development and eventually the opportunities that they will have access to as they grow up. So we need to intervene at the youngest age possible to make sure that these children have the most successful lives as possible in the future. So a common solution to this issue is the implementation of after-school programs. So after-school programs have shown to provide BIPoC children with resources that they need to be successful in school, both academically and socially, emotionally. So we're kind of providing them the stability that many children of color don't have outside of school, and thus giving them the resources that they need to be successful. So of course, like we've identified, there's so many sources outside of school that cause these issues, but this can be one solution that kind of help helps to tackle all of it. By introducing these resources on a broader scale, it is possible that the mental health disparities among the next generation can be shrunk. Too often, mental health and BIPoC community goes underreported, but we do know now that mental health is more prominent within communities of color. So by giving these resources at a younger age, we have a chance to close these mental health disparities that have been so prominent for the last century of generations. Now, let's jump into healthcare solutions. Now, I know we talked about this briefly, but there are multiple solutions that the healthcare system can adopt to help to, be part of creating sustainable solutions for health disparities. So this includes racial bias training. Oftentimes, we only think of racial bias training in law enforcement. However, when we look at the healthcare system, they're interacting with every single part of our community, and it is crucial that they have the tools that they need to be culturally competent when treating their patients. We need to get rid of outdated ideas about race and health. You might know that there is, this idea that Black people are more immune to pain or don't feel pain as much as white people or any other race. This is an idea that came about to help, justify slavery when it was introduced in the Americas. And it's still used in medical practices today. And that's where we get these ideas of like Black men and children not getting the same levels of pain medication as white children for the same injuries or illnesses. So we need to get rid of those outdated ideas about race and health. We need to invest in BIPoC medical staff and their education. So that means that we're investing in children at a young age. We're promoting them and encouraging them to join the healthcare system. And, we're investing in making sure that our healthcare offices within our communities are representative of the populations that they're meant to serve. And lastly, we need to pay doctors for value, not just service. So if a doctor is taking time to truly engage with the community, understand the issues that a community is facing, and works to solve them, then that's them presenting a higher value. So we want to make sure we're investing in those doctors as well. Next, let's talk about some community solutions. So what can people that are not involved in the healthcare system directly do to close these disparities? Well, one, we need to begin to do the work ourselves instead of waiting for others. So as a community, that means investing in solving healthcare inequities by redistributing wealth, by investing financially and emotionally into movements and organizations that are working to close these health disparities. We are actively contributing to creating sustainable solutions. And lastly, supporting locally owned Black and Latino medical practices. We want to make sure that we're promoting and encouraging, healthcare professions within the BIPoC community. And so sometimes that means going to locally owned practices, whether that be an eye doctor, a chiropractor, or, a general physician. We want to support these Black and Latino practices because oftentimes they're our best chance at closing and decreasing these health disparities. But lastly, of course, as people of color, we cannot wait for these large systemic changes to happen all the time to protect ourselves from these pervasive health disparities. So we have to learn how to cope and deal with the daily stress of living in a country with racial bias. So you can practice a couple of things to help deal with this. One is practicing biofeedback. Now, this is a short-term solution, but when you're feeling anxious, overwhelmed, you're starting to learn how to practice empty mind and focusing on breathing. This helps decrease overall cortisol levels in the moment. Daily meditation decreases cortisol levels overall. So for Black women particularly, or women of color, this can be a crucial part of guaranteeing or working towards guaranteeing a decrease in the chances of negative birth outcomes by working to decrease cortisol levels. Next, creating social networks for support. As we learned earlier, it is so crucial for people of color to have stable networks, support networks to vent and discuss the trauma and stress that they go through as people of color in America. And that overall helps close these health disparities. It makes people feel heard, and it's absolutely so crucial to maintaining good mental and emotional health. And lastly, for physical health, for BIPoC people, it is crucial that we begin to work to find Black, Latino, and other mental health health professionals of color. This includes mental health professionals, OBGYNs, and family physicians. So like we said, we cannot wait for the systemic changes in the healthcare system. So oftentimes, it is smartest for us as people of color to look towards representative medical staff and healthcare professionals to help to kind of prevent that disconnect that occurs between people of color and white medical professionals, to close the gap and the chances of occurring or experiencing health disparities yourself. So thank you so much for joining me today. That was just, a look into some of the research I did this year. I was absolutely so grateful to get a chance to learn about an issue so important. I'm, almost frustrated myself that I didn't know anything about this prior to this year. But I'm glad I was able to take today to kind of share some of this knowledge about something that I know now recognize as being so important. So thank you. I'm going to go ahead and come back from sharing my screen, and then we can start doing some questions.
And Georgia, do you want them to raise their hand or put it in the chat box? What works better for you?
We can have people raise their hands. I know there's some people in here that have not used Teams, so if you go to the top of the screen, so there's the bright red leave button, and then if you go a couple spaces over, there's a little hand icon, and when you click on that, it'll raise your hand. And when you're done asking your question, if you mute and then, unmute yourself and then mute yourself again and then lower your hand, that'll actually lower your hand, because sometimes Teams doesn't let you lower your hand manually. It's kind of weird, but yeah, okay. Miss Dunley.
I like to be first. Good. Okay, so on your one slide, we were talking about the healthcare solutions, and those seem to be very similar for what we need to do for educators too. Can you think of other professions where we would need to do those same kind of action steps?
Oh, absolutely. So I know I referenced law enforcement, one of the most important, we want to focus on parts of the community or professions that interact with the highest number of community members. Mm-hmm. So that would include education staff, law enforcement, healthcare professionals, as well as, government agencies. So, social workers particularly, and that's what the focus of my class was, creating culturally competent social workers is probably one of the most important things, because they literally interact with every single part of your life. They're involved in education. They're involved with the foster care system. They're involved in how the way that people parent their children. What resources families get from the government. So I think that that's probably one of the most important parts of our community to start to begin to implement these solutions.
Mm-hmm.
Miss House. Oh, you're muted. I can't hear you.
There we go.
I can hear you now.
Follow directions. I was raised by nuns. I'm afraid to make a mistake. Sorry. I want to thank you so much for multiple things. And you have no idea what my background is, but I was a teacher for 30 years with kids and 17 with adults. You see Miss Graber right there? Yeah. Okay. Anyway, so my gift was when I went to the area education agency, I got trained by all the reading, writing, and brain researchers. And I'm going to share with you what you just did, besides all the amazing information that affected our brains and how we understood better what you did by what you did and what you're talking about. So number one, your delivery is so professional. You paused at the end. You didn't say ever. And I don't mean that in a bad way, but we get nervous and comes out. That's why it's so important to practice. Look in the mirror, practice, eyes up, that kind of stuff. It is so important. And breathe about 400 times before you know what I'm talking about. Okay, number one, the first thing you did, because I was so fascinated, BIPoC, what in the world is BIPoC? Because I wrote down everybody's, I have my notebook, so I have everybody's page filled and whatever. And bingo, you just gave it to us. And that's called front loading. You front loaded us with the definition of what you were going to talk about, because you could have just said BIPoC through the whole thing and it wouldn't have made, right? Okay, cortisol, I'm probably have 400,000 of it running through me right now because I'm very excited about this. Oh, the structural role theory of the 20th century. OMG. And it's so true. Every part of it, I just sat there going, yeah. And I'm of the age where I couldn't do so many things because I was a woman. Right? Oh no, you can't come in here. Oh no, you can't have that job. Oh no. And then I guess the practicing of biofeedback, I think is one of the most important things we could teach all students. And really all adults, especially teachers. I mean, honestly, teaching is extraordinarily stressful, extraordinarily. So I think you have a job already in your life to just go ahead. So thank you very much for all your hard work. And hi, Delaney.
Thank you so much. Awesome. Let's see. I see another hand up somewhere. Nora.
Hi, so I have a couple questions for you. Do you have time for multiple questions?
Go at it.
Okay. So my first one would be, as someone who's like just starting their career in the medical field, how do they go about addressing this issue? Like someone who's still in college or still in medical school, what can they do to prepare for this ahead of them?
I love this question so much. Okay, so I watched a really interesting TED Talk about a pediatrician, and he was a Latino man, and he briefly addressed this. So he said, take as many classes in medical school. They're one of the most undertaken classes in medical school, but they have Black psychology. Like they have race-specific classes about mental health. They have Black specific classes about understanding the Black community, because one of the biggest focuses of my class that I took was understanding that different cultures and how you grow up affects the way that you interact with the healthcare system, your perceptions of health, and how you live, what you eat, how you exercise, how you dress. So by taking classes while you're both in undergrad and in medical school, because I truly did not believe that they had any kind of race-related classes in medical school until I did that research. By throwing yourself into that one, you might find something that you're like super passionate about, because that's what happened to this guy. Like he's written like 6 books about like race and the healthcare system now, because he took those classes in medical school and he just like fell in love with it. So I would suggest, educate yourself, throw yourself into these resources that you have, because there's people that are so excited to teach it. So I think that by preparing yourself before you even go into the medical field with this plethora of knowledge makes you a culturally competent healthcare worker before you even enter the field.
So my second question would be, if healthcare workers see this surfacing in their colleagues, they see discrimination or they suspect discrimination is at play, what should they do to address it?
Awesome question. So for healthcare workers, what we've seen specifically is that there is a very strong hierarchy within healthcare work. And so it can be difficult to present issues to colleagues that maybe have been practicing medicine longer than you or have a higher paid position than you. So it can be very difficult to present these issues. But I think what needs to happen, what has to happen really is talking to somebody that actually has power in that situation, that can implement things like racial diversity training, or has the, the power or authority to talk to that person that may be a higher rank than you. But I think most importantly, you need to speak out about it, because as we've seen, it can be deadly for people of color. If they aren't receiving the care that they need just because the doctor doesn't think that they need it, or doesn't believe that somebody of their cultural background could, experience pain in the way that they're saying they're experiencing pain, that can be a life or death situation. So I think that healthcare workers, as difficult as it is, have to be responsible for vocalizing those issues when they see it, and opening up conversation to address it. I think they need to be the first person to do it.
That's really interesting. And this is my last question, I promise. So how does, or what role does inequity in healthcare insurance play into this issue? How do those work together?
Absolutely. So that's a great question. So if you're familiar with actuarial science, which is basically just risk assessment, they have it in car insurance too, and they have it in criminal justice. What's the chance of this person, leaving if we give them bail, that kind of thing. So actuarial science is all ingrained in our society. So for healthcare, the role that it plays, or insurance particularly, is they will determine, these actuaries will basically determine what they think that person, and race plays a factor in their calculations. It's all math somehow. It's all math. But they basically determine, they factor in race in whether or not they feel like this person will experience health issues in the future. And this can go, one or two ways. They can think that either, wow, this person is a person of color, they're statistically healthier, they're obese at a higher rate, et cetera, they're Native American, so they experience obesity at a higher rate, or they're Latino, so they have a higher risk of kidney issues. We're going to bump up how much their insurance is going to cost and their monthly premium, or whatever, all that stuff. And they were going to make it more expensive. Another issue that happens, however, and this kind of goes into the work conditions portion of social determinants of health, is that people of color often have less access to quality health insurance to even begin with. Either they can't afford it, they simply don't have access to it. And so if this presentation wasn't enough to convince you on universal health care, I don't know what can. But I think that that's one of the other big issues, right? It's it's hard for people that are working, low income jobs to afford insurance, which most of the time is a scam and doesn't even cover the expense of the issues that they're most likely to come across. So I think that it's a very complex issue. I don't think that there's a one size fits all solution. I think we got to scrap it and start over. I think that's a universal healthcare solution that we need, because that's a good question you brought up. I really don't think that that's something that can be fixed. I think that through actuarial science and access to healthcare, I think that there's literally no way to get the racism out of it. As simple as that. I think it's ingrained into that system, which is really frustrating, but I think that's the reality of it.
Thank you so much.
Yeah. Are there any other questions? And you can either raise your hand or put it in the chat, whatever you fancy. No,
I think Nosa has it, yeah.
Okay, I'm raising my, I don't know how to use this thing, but thank you. First, I want to say you did an amazing job. I want to echo everything that Ms. House said. You were an amazing speaker, and all the information you presented showed that you really did the research and that you are really knowledgeable on this. So I want to say that you did an amazing job. My question is, did you come across any challenges in addressing these disparities? And if so, what were those?
Yes. I am really baffled by how new this research is. Like, regarding health disparities and how to create solutions. Like, most of the studies that I came across, oh my God, I guess it's 2021 now. So probably are like 3 years old. So like, they're like, I implemented this solution for the first time ever in the history of America. And this was the small scale I was able to do it on because, you know, they're just like an independent researcher, right? So it was really hard to be able to say, like, this solution has consistently worked for like the last 30 years and it's been implemented in this region of the United States, because people kind of like started thinking about it like 2000, 2002, and then just like forgot about it, like completely forgot that this was an issue. So that was extremely frustrating, that this is like, that so many people have lost their lives because people just haven't thought of this as an important issue. Even though we knew it was an issue, people just didn't think they needed to really address it. It was just like, it is what it is, you know? So that was probably my biggest challenge in research, is that everything is so new. And so I felt like I was kind of like, I don't know. I feel like I got in on this really early, surprisingly. And so there was an issue with finding, you know, applicable and, you know, solutions that were proven to be sustainable and effective, because like they haven't even tried to do that yet. So that was probably my biggest issue, I think.
Yeah, and if you don't mind me asking one more question.
Go ahead.
So for like what came to mind to me is like the trust gap between like the African American community and BIPoC communities and the healthcare systems. So like, was there any did you come across that, and like maybe how would that be addressed in the solutions if possible?
Absolutely. So in my course specifically, they talked about basically the cultural disconnect between a lot of Americans of color in the healthcare system, because there is such a strong history of people of color being underserved by our healthcare system. And that's created a model of distrust. Like, how are you supposed to trust these people that are supposed to take care of you? Very similar to distrust of law enforcement, when they've consistently shown that they just won't do it. Like, they're uninterested in properly serving you. And so a lot of my course was focusing on creating culturally competent white doctors, because so much of our healthcare system is made up of white professionals. So they kind of see, like, a lot of my course, and this was kind of problematic, was like their only solution was like, how do we educate white people? However, my personal thought on this is that we need to push more people of color into the healthcare industry, rather. Like, we don't need to like teach white people how to not be racist as much as we need to decolonize the healthcare system in and of itself, right? So by putting in more people of color, and as dumb as this might sound, that's going to humanize people of color to white professionals. And I know it sounds like, oh my God, we should not have to do that. We do. Like, we have to do that. So I think that while they're kind of focusing on creating culturally competent white professionals, I kind of want to shift that and say that our focus should be investing in Black youth, their education, and then pushing them in to these healthcare spaces, and creating more opportunity for success in the healthcare field as a person of color.
Yeah, those are all great points. Something that I've come across in my college classes is that the suggestion of like having more Black doctors or like more Black health professionals sometimes puts like a load on those healthcare workers to do the equity work for, I guess, this system that's not just for Black people. So yeah, that's always like a concern that comes from me whenever I think of that too. But thank you.
No, and I absolutely agree, because, and this is really prominent, a lot of what my independent research, when it became independent, was Black mental health professionals, because everybody, therapy is so, in communities of color, oftentimes like they reject the idea of therapy. Like, you don't put your problems on other people, but it's so crucial. And so for people of color that want therapy, there is such a lack of representation of like therapists of color, that therapists of color can feel extremely overburdened and like, I need to take on as many clients as possible because there's nobody else to do it. And I'm almost positive that this is reflected in other, healthcare professionals as well. But I thought like there's such an, like, we expect, and this is a problem in equity work in general, like we expect people of color to do the work. And so it's finding that balance of like supporting people of color, but also like forcing the people that are causing the issues to also create the solutions. And it's finding that like happy balance between the two. And I think that that's something that we really struggle with. Are there any other questions?
You did an awesome job.
Thank you.
I'm wondering also with the individual solutions and some of those things we need to teach kids, right? So that they practice early. But when would you do that? And then how would you embed that? Where do you think that could be embedded?
Like individual solutions?
Yeah, the ones that you said, like the biofeedback and the daily meditation. And
I think that needs to be introduced at an elementary school level. I think as young as possible, because that's also the time where people and children begin to become aware of their racial identity, and like start to be introduced with, be more aware of their culture, maybe what makes them different from other kids, which is amazing. But we also need to prepare them for society's negative response to them, because there will be one. Society is going to reject what's different. So I think that by giving these children, however young they are, the tools that they need to self-regulate and be self-sustaining and be comfortable in themselves, I think that's extremely important, because I was frustrated because I had never heard the term biofeedback before this course. I had never thought about, how racism causes stress in Black women. Like it directly, like Black women are like the most stressed out part of our population, like point blank period. Like we are so stressed out. So I think that if I would have known how to prepare for that maybe at a younger age, maybe that would have set me up for more success throughout middle school and high school, and coming to terms with my racial identity and like the instances that I had to encounter. And I'm sure that's the same for every other young Black girl, like having the tools that you need to be successful and be comfortable in your identity, should be introduced as early as possible.
Yeah, can we add that to that map we were thinking of for second semester?
Yeah,
I think that's all, and I don't know if we already did the SEL specifically for BIPoC students. I don't know if we added that, but that seems like something that should be added based on what you presented
I
today.
can do that right now. I'll put that on there after this.
Okay.
I'll put it on the
Well, you
mind
don't
map.
have to do it right now because you're in a presentation.
Oh my God, I'm sorry. Ideas, Miss Dunley.
Thank you again for a delightful way to move into the afternoon, and please continue this work.
Thanks
honestly.
so much.
And
So
if you
glad-
ever need anything, because I taught people exactly what I have, stories that you could use. I'm just saying.
Thanks so much. I really do appreciate it.
Okay, have a wonderful, get outside, ladies.
Yeah, and thanks so much to our audience members. I love having our former students coming back. I love that. So
It's
thank
Lone
you so
Win.
much.
There, I taught in second grade. Look at, hi, Lone. Oh, look at you. Oh, you are adorable. Do I look exactly the same?
It's a great reunion for people. I had Georgia as a student, and Georgia was also on the debate team. So we